So you just had a tooth pulled, or you've got one coming up. And the big question is, how do you heal as fast as possible? The truth is, recovery doesn't have to be slow and painful. But that's only if you avoid the mistakes so many people make right after an extraction. As a dentist, I'll show you the 5 most powerful steps to speed up healing, cut down your pain, and prevent complications like dry sockets, which is, by the way, very painful. And make sure to watch till the end, because the last step is the one that so many people miss. And yet, it can save you from weeks of unnecessary pain. So, after a tooth extraction, your body goes into healing mode. A blood clot forms in the empty socket, and that blood clot is crucial for your healing. Think of it as your body's natural bandage that protects the bone and nerves and everything underneath. And if you protect that clot, the healing will be smooth and fast. But if it's disturbed in one way or another, you can end up with one of the most painful complications in dentistry: dry socket. That's why these recovery tips are so critical. Each one will help you protect that clot, lower your pain, and accelerate the healing process to the max. The first 24 hours are the most important. Apply an ice pack to the outside of your face on the area where you got your tooth extracted. 15 minutes on, 15 minutes off. This reduces swelling and numbs the pain before it even starts. You can take this to the next level by placing an ice cube in your mouth. It numbs the pain immediately. But just make sure you don't put the ice cube directly on the socket, because you want to protect that clot. And here's something most people miss. Avoid spitting, rinsing, smoking, or using straws during this time. The suction can displace your blood clot, leaving the bone exposed. And that's how the dry socket happens. So protect it like it's your precious baby. After 24 hours, you can begin gentle cleaning. The easiest and safest way is a warm saltwater rinse. Mix half a teaspoon of salt in a glass of warm water and gently let it roll around your mouth. Don't swish hard to protect the clot. Saltwater is nature's disinfectant. It reduces bacteria, keeps the area clean, and supports tissue healing. Do this 3 to 4 times a day, especially after meals, to clean up your mouth from any food debris. It's simple, free, and one of the most effective ways to prevent infection. Now let's talk food, because what you eat can either slow your recovery process or help you heal faster. For the first few days, stick with soft and nutrient-rich foods. Mashed potatoes, smoothies, yogurt, scrambled eggs, soups. Avoid anything crunchy, spicy, or hot. Those will irritate the wound. And here's the key. Do not chew on the extraction side. Give it complete rest. It has been through a lot. And avoid alcohol and smoking. They both delay healing and increase the risk of infection. For pain, cold compress and ice cubes are my go-to choices. Or anything cold basically, because it helps with the pain. But on top of these, over-the-counter medications like ibuprofen and paracetamol work well. And taking ibuprofen and paracetamol together often works better than either one alone, because they have synergistic effect. But always follow your dentist's instructions. And here's another tip many overlook. Sleep with your head slightly elevated for the first couple of nights. This reduces blood flow to the area, which means less swelling and pain. Many are surprised at how much difference this makes. But here's the danger zone, and this is where most people go wrong. They feel fine on day 2 or day 3, and then they go back to chewing and exercising or rinsing aggressively. But the clot is still fragile. The tissues are only starting to rebuild at this point. If you push it too soon, you risk breaking that clot and starting the healing process all over again. So even if you feel great, give your body the full healing time, usually 7 to 10 days. Think of it like concrete drying. It looks solid on the surface, but if you touch it too early, it cracks. Follow these steps and you'll heal faster with less pain and much lower risk of complications. If you found this helpful, hit subscribe and click here to watch my video on what your tongue says about your health. It could reveal hidden problems you'd never expect, and you don't want to miss it. Click right here and see you there.